欢迎大家今天来参加我们的讲座。那我们今天的这个话题就是护理院和长期照顾。我知道社区里面很多朋友都是很关心这个话题，也是有很多的问题想要了解。那我们今天的这个讲座内容非常的多，所以也不会大家可能不会一下子听了讲座就什么都了解。我们的专家会最后的时候留一些时间给大家问问题然后就是有自己的问题的话，也可以另外的时间去咨询我们的专家。那讲座之前就是先跟大家讲一下哈，我们11月18号会有新冠疫苗的接种，我们18号会有 Pfizer 和 Moderna 2种新冠的加强针，就是现在经常也很多朋友问我们，这个是不是最新的这个疫苗是加了这个预防 Omicron 的这些成分的。那可以跟大家讲，现在市面上你在任何的地方去打这个新冠疫苗的加强针，肯定都是新2价的，肯定都是有最新的这个加入成分可以对抗 Omicron 的，所以大家不要担心。有需要的话就是上我们的网站，或者是打电话到我们泛亚诊所2403935950预约。OK， 我们也是在造这个 mental health 的这个服务的专员，大家知道有合适的人给我们推荐一下。另外就是这个流感疫苗，提醒一下大家，如果你还没有打流感疫苗的话，非常建议大家一定要打一下。我们现在慢慢都看到，就是今年的这个流感特别的厉害。我自己的家里人一个18岁的小孩子，那个得了这个感冒，其实不是感冒，既不是新冠又不是感冒，是一种很厉害的病毒，也不是新冠，所以就是说很多不同类型的那个 virus 在市面上，所以你能避免的就尽量都避免。所以流感疫苗没有打的还是需要打。Okay, with that, 我们今天就是下面交给我们的客人。Today we are so honored to invite Jheni and Maria to give this very important health talk on long-term care and all the options for taking care of yourself at later stage of life. And so today's presentation will be in English, but I will try to summarize at the end of each slide. So don't worry if you don't totally understand everything is said here. And again, like I said, we always leave some time for Q&A. And also we will leave the two speakers' contact information in our chat box. And if you have questions later on, you want to consult them, feel free to contact them. Okay, so I will have Maria, maybe you can introduce yourself a little bit and then you will start your presentation. You are muted.
Thank you. Thank you for having us. Thank you, everybody, for allowing us this time. My name is Maria. I've been working on healthcare industry for a little bit over 14 years. And specifically for the skilled nursing facilities, long-term care, and everything that has to do with insurance. So my area of expertise is insurance, is understand, help, and today my goal is to help you understand a little bit more of how insurance works, not only Medicare, long-term care specifically. I think that's the focus. Share with you guys a little bit more of the long-term care. How does it work? And if you have any questions, I will be happy to answer them, or if my information will be shared and you want to directly contact me with no free of charge, no cost at all. My intention is just to be able to help you understand and guide you to make the best decisions are possible for you. So like I say, my information will be shared, and I always get phone calls, emails, texts, and I will be happy to address them. I do not speak other than English and Spanish. Those are my two languages, but I'm pretty sure Kate will be also happy to coordinate if any of you needs assistance or has a question, and she will probably help us to translate. So I'm happy to do that too, okay?
It's perfect. So Maria 是一个在 long-term care 就是这个长期照顾这个领域已经工作10几年，非常有经验的一个从业人员。然后她就是那个主业就是在这个长期保险的这个部分，所以他对 Medicare 和其他的商业保险对long-term care 这个涵盖的方面的那个信息是非常专业的，他非常乐意给大家回答这方面的问题。Jheni, you want to introduce yourself?
Hi everyone, my name is Jheni Libongco. So I'm also been in the industry for healthcare for about close to 20 years now. I also the CEO of Continuum Healthcare Network. So we are also community resources, and we provide a lot of assistance to the seniors to understand the skilled nursing facility, assisted living, and other services that any seniors might need when they want to go to this place. Today, I'll be discussing about the skilled nursing facility. What are your rights when you are in this skilled nursing facility? What type of services you're going to receive? What type of program that will actually benefit you and help you? And also what places you can find all of this location and their specialties. So we'll discuss that. And Kate will provide you my information, and also we'll about to open our clinic, which is in December 15th. So we'll able to come to our facility, to our clinic, and we provide you resources and information as well too. And call, email will work. I'm just started studying Mandarin, so my first class was last night. It was so good. Xinhua Jheni.
Jenny 新华，对 Jenny 其实是菲律宾人哈，然后她是在那个在healthcare 里面很长时间的这个服务，然后她也是运作一个就是长期照顾的一个机构的联盟，所以她是在这边在这个领域做advisor， 就是做咨询专员已经很长的时间，所以他在这方面有非常多的这个经验可以跟大家分享。Okay, with that we can start today's talk presentation.
Okay. Can I start by sharing the presentation?
Yes, please.
Okay. This is exciting. So today's topic, aging health, short-term and long-term care. As Kate explained to us, you guys already had previous information on how Medicare work. So I'm going to try to not bore you with that and be as brief as possible.
所以今天主要的话题就是关于保险和养老、医疗、护理方面的内容。
Yeah. So the objectives of this presentation is, I'm just going to summarize it, is to at least list for you guys what are the main benefits of having the knowledge of how to use the Medicare and Medicaid in the different fields of the healthcare industry, right? Specifically for skilled nursing facility as well, long-term care. We want to also focusing and help you to identify the different types of services provided in the community. What is the difference between assisted living facilities, home health, hospice, actually the difference between long-term care and short-term care in a skilled nurse facility, and explain how shifts in demographics are impacting right now for the healthcare workers and all the healthcare facilities that are in the community. And Jheni will go further on discussing the trends in long-term care healthcare, including the community-based care needs.
所以今天的主要话题就是包括这些保险的那个对养老的医疗费用的一个涵盖，然后就是还有很多你们可能有听说过的一些词哈 ，skilled nursing， 这个 home health hospice， 就各种不同的名目的这种对这个不同名目的这些名词，我们今天会跟大家解释一下，然后就是还有一个会讲讲现在的趋势哈，就是人口的那个成分的改变以及这些养老机构其实它的服务也在想办法去转型，所以这方面的发展会跟大家分享一下。所以sorry Maria, I mute you a little bit because of the background, but you go ahead and you can unmute yourself.
No problem. Thank you. Let me see. This is a little bit more information on how the what are the part of the goals that we have. So I'm just moving to some information. As you see over here, by 2050, we are foreseeing an increase on the life expectancy for people that are 65 and older. So there is a 20% of the US population right now that we believe by 2050 will be in need of type of placement or type of need from in the healthcare areas due to the age. Those that are 85 and older, I will say older generation within elderly are the fastest growing segment of population. And these are just stats which showing that 61% of those are women, and unfortunately mostly widowed women, right?
Yeah， 所以这个是这些数据就是显示美国人口的一个改变，那越来越多的人变得年老，然后就是当然那个寿命比较长的一般都是女性，所以这个是一个大的趋势。Maria, you stop sharing.
Oh, let me see why.
Okay, yes, we're good.
Okay, sorry about that. Okay, one of the main reasons that we are having we are predicting this percentage, it's because of the chronic disease that are rising, both emotional and physical. We will say instead of emotional, it's mental health issues as well, physicals. There are the ones that causing these future disabilities, or the reason why we will have that percentage.
对，所以这个图就是指出来一个很重要的一个方向，就是未来的这个疾病，其实很多的那个发生的那个方向就是长期疾病、慢性疾病和因为情绪身体的原因那个发展出来的这些疾病，将会是这个 healthcare 就是医疗的主要的方向，大趋势。
Thank you. There's some people trying to get in, just FYI. Common health problems of the aging population, some of the things that you saw on the sign, most prevalent chronic conditions in 2020, we foresee hypertension, which is most people know as a high blood pressure, arthritis or arthritis, heart disease, cancer, diabetes, and an update on the website CMS on this update happened on 2021, where these are the most common disease, and depression was one of the top 7, just FYI, as you see on the list.
所以2022年的这些普遍的疾病也是我们大家常见的高血压。Can you go back to the last?
Sure.
Okay. 所以就是常见的就高血压、关节炎、心脏病。Can you going back to the yes? 癌症、糖尿病，哈，这些都是我们熟知的老年人的常见的病。大家可能忽略一个就是忧郁症，其实也是前7名，就是最常见的这种疾病之一。Thank you.
So some of the limitations that we are finding dramatically after the age of 85 is hearing impairment, visual impairment, and most debilitating conditions, dementia, stroke, hip fractures. Some of these even preventable ones.
对，那对于85岁以上的老人，比较常见，当然就是听力、视力方面的这些障碍。
Thank you. We're gonna briefly talk a little bit of the Medicare. Just like you mentioned, Kate, that they already understood or had already previous information on how the Medicare works. Just basically
go ahead to go through this list. I think it's beneficial.
Okay, excellent. Just a little background, and this is not here in this slide, so you may want to summarize to them. Everyone of the age of 65 and that has worked for 10 consecutive years in the United States, before they turn 65, if they work for 10 consecutive years and contributed to Medicare by the age of 65, they are entitled to Medicare. There is a specific enrollment period, which usually starts from October 15 to November 15. Right now, we are in that enrollment period time. So for those that are 64, about to turn 65, or they're already 65 and they have not yet applied for Medicare, this is the time.
对，所以就是这些是不同的这个Medicare cover 保险，那大家都很熟知是 A 部分是住院的 ，B 部分是看医生治疗的。那有一些人也会买一些补充性的这种Part B 就是补助 Part B 看医生部分不 cover 的内容，但是所以很多人都会买一些补足性的哈，但是很多补足性的这些医疗都不会去包括牙科、视力。足病和那些常规的体检，然后 Part C 就是Advantage Plan， 我们之前也有开专门的讲座，有讲过，就是要买另外一个保险来补足 Medicare 不付的部分。Part D 是药物的保险。
Thank you. So Medicare is divided in 4 groups, but it's actually 2 that are the main ones that they should know, which is the Medicare Part A, B, are the ones that are covering most of their expenses when they go to the hospital right now. And then I'm going to start moving into Medicaid. Do you want to share the last of Medicare?
Yes. So it's okay. You can go ahead with Medicaid.
Okay, thank you. So Medicaid has 2 branches. One is the community and the other one is the long-term care. So Medicare acts as a supplement insurance for the elderly when someone already has Medicare, or in some cases, if a person doesn't yet qualify for Medicare, has not reached the age of 65, or does not have the benefits of Medicare, they can in some cases apply for the Medicaid. Now, just a big distinction, Medicare is the federal insurance. Medicaid is the state insurance.
对，所以刚才 Maria 分享就是 Medicaid 是州的那个医疗的补助，对于低收入的人群，它会提供一些帮助，就是涵盖 Medicare 不包括的部分。那他有讲到2个部分，一个就是平常这个医疗看医生的一个Medicare 不付的部分，它会涵盖；另外一个就是 long-term care， 就是到年老的时候需要更多的医疗照顾或者需要养老院服务的时候 ，Medicaid 会去 cover。
So one of the most important things to learn about Medicaid is that they will cover anything that Medicare doesn't. So that's what the supplementary part comes to it. Now, the community Medicaid can even help to pay for anything in the community that Medicare doesn't pay, but also cover up to 30 days of rehab for some of the residents that need to go to a facility and does not have Medicare yet.
所以
Go ahead.
Okay, so Medicaid 会 当然就包括就是可以 cover Medicare 不付的部分，那另外还有一个就是说，如果你有 Medicaid 还没有 Medicare 的话 ，Medicaid 可以付30天的这个 long-term care， 就是这些长期照顾的这些机构的一个医疗费用，就是在你还没有 Medicare 的情况下。
Yeah, thank you. Another important thing to mention is that there should be no fee when you are applying for any of the benefits, Medicare or Medicaid, whether it is community or long-term care.
所以有一点，Maria 想提醒大家，就是说，你去申请 Medicaid 和 Medicare 的时候，应该是不用交任何的费用的。But I know some agent they charge a fee.
Yes, they do, but because they're helping you with the process, right? So, but when you do it through the websites of the actually government website, there is no fee to apply for it, which is different. They charge you because they're helping you to collect information as well filling up the application, but there is not extra fee for the actual application of the benefits.
That makes sense. 所以我刚才就是问了一下，就是说有些人可能帮别人去申请 Medicare 会收一些费用，那这些费用主要是他的时间和他帮你的这个就是那些努力的一些就是一些费用哈，但是不是 Medicare 本身会向你收的费用。
Now, it is important to know that when these officials, like you mentioned, it help you to fill up the applications because they are able to walk you through some loopholes, because both benefits, Medicaid, community as well, Medicaid, long-term care Medicaid, have strict requirements in order to meet eligibility. By that mean, in the case of community Medicaid, what their coverage is less, but there are also requirements to qualify. It's a little bit less restricted than when it's the long-term care at the nursing home.
对，所以就是说当然你都可以在那个网站上去申请这些 Medicare， 但是有一些就是这些医疗专家或保险专家，他们会比较知道哪些地方你可以去有一些灵活，有些弹性，你可以用到他们的服务。尤其是当我们要考虑这个长期照顾 long-term care 的这个服务的时候，这些专业人员会比较能帮到你。
One of those requirements for the community, it's, for example, to have certain amount of income or assets overall. So when they consider your assets, they're taking everything in consideration. Cash that you have in the bank, if you own a house, if you have a property, in addition of the house that you're living, they will take in consideration your 401k. They will take in consideration your life insurance that in some cases have a cash value. So they take all of that in consideration. I like to also add that they will consider your spouse assets too. Mostly if you marry or have a common law marriage, meaning you've been together for more than 5 years and declaring taxes together.
对，所以其实 Medicaid 当然对收入的有一个很严格的要求。那除了你的收入，就是每个月的收入以外，还包括你的资产。那资产当然就包括银行的存款甚至你的 401k 也算是你的资产。你的房子的价值多出来的一个房子，除非你是自用的。然后另外就是刚才 Maria 有提到，就是这个 life insurance， 就那个医疗保险不是就生命的保险，如果你有买这个，也算是你的资产。
Thank you. I'm going to move to another slide. I think that covers the most important things when it comes to learning about Medicaid. And I'm going to specifically now extend into long-term care Medicaid. So for long-term care Medicaid, which is the one that can be only applied when you're already in a nursing home setting. So community Medicaid, you can apply in any of the centers of Social Security office, in many occasions in a hospital setting or community social workers. Now, long-term care Medicaid only can be applied through a nursing home. And that's when you will need to meet both eligibilities. One is a clinical eligibility, meaning you will have to, the facility will have to fill up what they call a 3871, and a specific form that asks clinical questions about the person that is applying for long-term care Medicaid, or for the patient on behalf of that who's going to be beneficial of the long-term care Medicaid. In this case, questions go all the way to mental health as a physical clinical need. And the most important is if this person is in need of 24/7 nursing care, which means you will need to be monitoring by a registered nurse 24 a certain period of time during those 24 hours, which is sometimes the difference of why someone may not qualify. Go ahead, explain that, and then I go. I don't want to put too much for you.
I think I get it. So so 这个 long-term care 就是这个长期医疗保健，其实也是刚才讲到 Medicaid 里面的一个部分。所以就是当你有两个标准哈，什么时候才能那个 qualify 这个 long-term care？ 第一个就是你要有，当然你要符合 Medicaid 的资格。另外一个就是你要有那个身体和精神上的这个需要长期照顾的这个需求。那这个长期照顾就是指24小时，每个星期7天的这种长期的这种照顾。所以有时候他提到有一些例子，就是说这个人是有需求，但是不是24小时的照顾的需求的话，有时候他们的申请会被拒绝。Okay, I'm good. You are mute again. Maria, you are mute. We cannot hear you.
Sorry,
Okay,
my
good.
screen, the bar disappeared for the questions. I mean, for me to activate the mute button. I want to continue just sharing once about the eligibility for long-term care. As I mentioned, in the first eligibility that the facility will do, as only long-term care can be applied only at the nursing home level. And the first step will be filling up the form 3871 to ensure that this person met a level of care that will require for him to be monitored for a registered nurse for 24 hours a day. Once that is approved, then the facility will move into the financial qualifications. If it's a single person, whether because they're widow or they're being single the rest of their life, in order for them to qualify, they cannot have a total of assets more than 2,500 on assets. If they do have more than 2,500, the state will expect you to spend down in order to meet eligibility. What does this mean? It means if you have a life insurance, you will have to cash it out. It means if you have properties, a home, the state will expect you to sell your home and then use that cash to pay for your care. Now, when you're applying for long-term care, in some cases, they will want to see bank statements up to 5 years back of what you have had. And this is why, in some cases, if the person that is applying for long-term care has assets, 401k, life insurance, money in the bank, it is important that they get advice by a professional, whether a senior advisor or an elderly attorney, because they can help you to protect your assets, or they can guide you on how to actually spend down in a smart way. There are specific ways that the state allows you to spend down. For example, you can pay ahead for funeral arrangements, or you can actually pay for specific dentures. So if I'm a person that for many years was cautious and work hard and save money. Now I'm able to use the money, but it has to be spent on healthcare for myself, or like I say, for a specific things that I may need on time of that.
好，那刚才忘了就是跟大家解释，就是这个 long-term care 是 Medicaid 的一个部分，那只能是当你在 nursing home 的时候去申请，这是唯一可以申请的途径。然后就是他当然对那个你的资产有要求，刚才有提到过，就是一家人的话不能超过2500块钱。如果你是有资产，你拥有自己的这个存款啊。就是那个生命保险或者是退休金之类的，那政府会希望你就是先把自己的这个 saving 这存款花完，直到就是在2500块钱的那个范围以内，这个 long-term care 这个 financial 就是这个医疗的这个收入的资产的补助，这个 long-term care 这个保险才会生效。那刚才 Maria 有提到，其实是有很多方式可以去就是合法的把你这些资产用完，比如说就是安排将来的这个葬礼，或者是用这些钱来做那个牙齿的护理，或是牙齿的这种用具的一个购买之类的，这些都是合法的可以用的。那你申请这个 long-term care 这个 Medicaid 这些这个申请的时候，这个政府部门是有办法或有权利可以看你那个你申请往前的5年以内你的那个银行账目的这个出入的情况，所以大家有这方面的需求的话，需要去咨询一下专家，比如说 Maria 这样的专家，或者是医生，有一些不是医生，有一些律师是专门做这个 Medicaid 方面的这些咨询的。
Thank you, Kate. Another of the, I will say the last piece of the eligibility for long-term care Medicare will be to know that if you have a social security income that you're receiving, or a pension or a disability check, that will be turning into the facility to help cover the stay of your stay at the facility. So once you meet the eligibility for the level of care, meaning when you meet the criteria clinically, you are considered clinically okay to be approved for long-term care, then they move with that level of care, they submit an application, which is quite thick. And you submit the application that is actually that you declare all your assets. Now, mind you, that the state knows everything about you, how much you own, what don't you own, why do you have money in the bank, or why you do not. And sometimes if they see that you used to have money in the bank, but then you decided to donate it to grandchildren, they can penalize you and not grant you Medicaid for X amount of years on the future. Now, once you get those applications, if it were to happen that you no longer have a bank account, or you don't have a 401k, you don't have a life insurance, they will grant you Medicaid, but they will expect that any other income that you have as a pension, social security, disability is used to pay for your stay at the facility. The way that the state and the government see it is that they're sending you the social security or the disability check for you to cover for your room and board, meaning for your housing, meaning for your food, and for your medication. And while you are in a long-term care setting, you are obtaining all of those benefits. So the state, the way the state see it is like they're expecting you to also give your part. If you are a single person that is currently receiving disability and going to a nursing home, and you meet the level of care criteria, then you also meet the financial, then they also will expect you to turn in that income. If you get, let's just say, for example, if the facility charged to the state $5,000 a month for you stay in the building, and you receive $1,000 a month, the state only will pay $4,000 to the facility and will expect that the facility collect the other 1,000 from the check of the disability that the patients receive. Now, the person is allowed to keep about $94 out of the check. Everything else is all to the facility.
Maria, let Kate translate that in Chinese.
I think it's Thank you, Jenny. 所以刚才有讲到哈，就是那个 long-term care 或者那个 nursing home 的服务，就是两个要求，一个是你的身体状况是不是符合这个 nursing home 这个标准，那是那个身体的状况、精神的状况。另外一个就是你的收入的这个标准。那如果是就说之前讲过哈，就把你该有的钱该花的花，该照顾自己，然后你符合了他们的那个财产的这个标准以后，你也愿意，你可以去入住了以后，那你属于你的这个退休金啊，这些SSI 啊，就是那个补足金啊，或者是 SSDI， 就是这个残疾的那个款，那个补足款，这些都会就去到 nursing home 这个里面，就是要全部交给他，你只能留94块钱的这个日常的这种 pocket money， 就是可以花一花的94块钱。那这个道理就是说 nursing home， 比如说 nursing home 它一个月需要护理里所需要的花费大概5000块钱的话，那如果你有1000块钱的这个退休金的收入，那state 就是这个州政府它只会付4000块钱的这个付这个疗养院4000块钱，剩下的1000块钱这个养老院它需要向这个 Social Security 去收，所以是这样一个关系。
Last part that is important to mention is once you get approved by Medicaid and you get the level of care approved, you get the application approved, and you submit everything, you are turning in your income to the facility. You have to keep in mind that Medicaid is expecting you to pre-cert or reapprove every year.
Mm-hmm.
So every year you will have to reapprove. Now, once it's approved once, if your clinical conditions stay the same and your financial condition has not changed, most likely you will be approved and the process is done way faster. So the only difference will be at this time to show them that you didn't win the lottery and that now you're rich. Exactly.
Yeah. 所以刚才提到一点，就是说 Medicaid 因为它是跟收入相关，那收入是会变的，所以按照就是操作上 Medicaid 每年都会再看看你的资格，就是财产资产方面的资格还符不符合要求所以每年都会要做一次这个资格的审查。那当然就是一般来说对老年人来说收入大概都是稳定的，除非你中了6合彩，所以这个重新审核的这个过程应该是相对来说比较简单的，但是是会有这样一个过程。
That's basically the ABC of the long-term care, right? That's what the qualifications are. Now, having long-term care, it really covers you and opens the door for a lot of other benefits within the community. So whether it's you decide to have long-term care and you no longer want to be at that nursing home, want to go to a different one, you can transfer from one nursing home to another one, whether they were the ones that get you or not the long-term care Medicaid. There is a specific form that you just fill up and say, I want to go to this place, and it is transferable. Another important point that I also like to mention with Medicaid is that Medicaid also have some coverage in the community. And long-term care is a benefit that you also are entitled to because you pay for it.
Mm-hmm.
When you see on your paychecks, you were contributing to Medicare, you were contributing to the state, and you also contribute to Social Security. And the Office of the State and the Social Security is what made up for the coverage of you stay and the long-term care in a long-term care setting as a nursing home or any other centers.
所以其实大家交税的时候也是交了一部分这个 long-term care 所需要的费用。那刚才 Maria 有提到，就是说long-term care 是一种就是审核过的资格，你一旦有这个 long-term care 的这种 status， 就是这个资格的话，那你其实是可以从一个养老院不喜欢的话，你可以转到另外一个养老院，或者是有一些时候就是有一些 long-term care 会 cover 你不喜欢在疗养院的这种，不喜欢住在里面，你希望在家里，但是就是需要有一些服务，那他们也有这样的项目可以cover 这方面，就是养老院这个层次的这种护理，但是不是在疗养院里面提供的这些服务。
So that's basically the long-term care. I will be happy to answer any questions you have for Medicare or long-term care. And now Jheni will talk about the different places that are recognized as a home, whether it's a long-term care, nursing home, etc. Thank you, everybody.
OK， 所以Maria 刚才就 cover 了一下这个 long-term care 这方面的这个内容。如果大家有问题的话，欢迎大家在这个 chat box 里面哈，在聊天室里面把你的问题打出来，中文、英文都没有问题。我们在后半段的时候会跟大家解释。那我们现在进入下一个话题，就是这个 skilled nursing 和 intermediate care facility 的这个解释。
Hi. So I'm going to continue about the intermediate care facility, but for the essence of the, I felt the importance of all of the information that Maria shared with you guys. So I'd like to entertain first the questions, because I know there's a lot, because I've met a lot of seniors asking a lot of questions. So Kate, for the purpose of this presentation, I think that's for me, we can schedule the other part. Let's open up the question and answer for our seniors, because
yes,
this is very important for them. The Medicare benefits and the long-term care, how they can qualify and what are their issues and what they encounter currently right now.
Yeah, so 如果大家有问题的话哈，就是关于刚才的这个 long-term care 长期护理这个保险是怎么运作的，我希望大家还都听得明白，因为是蛮复杂的哈。如果大家有问题的话，可以在那个 chat box 里面打，就是提问。然后Jheni, so far we don't have any question. So if you maybe explain to us the skilled nursing facility, in intermediate care facility, like just the service level. Yeah.
Yes. So a skilled nursing facility is a federal it's a through CMS. So we are responsible in providing care for the seniors. So when we are discussing about the skilled care, so we are providing, if you have other diagnosis that needed a skill care, that will be going to the skilled nursing facility. So I will explain that on the next slide. So individual states also have different standards that we need to meet. So all of your Medicare will qualify to any of the state because it's a federal it's a federal benefits. So your Medicare. So if you are in California, and then your family member is in Maryland and they want you to move over here, you're still qualified to come over here in the nursing home. So that's one thing that you need to understand and know also, or vice versa. If you're here in Maryland and your son and your loved ones want you to move to a other state, like in California or in Virginia, you can actually transfer. And let's say if you're in the hospital and you need to be transferred in a skilled nursing facility on that state, that is allowed.
所以 skilled nursing， 所以what's the difference between the typical nursing home and the skilled nursing facility? Is it the same thing?
Well, no, skilled nursing, we are focusing on the nursing services. So it's a 24-hour nursing services. We manage medication supervision. We provide also rehabilitation, can be physical therapy, occupational therapy, speech. When you have a cardiac arrest or you have stroke, so we focus on rehabilitating that. We also have we provide all of your medication and all of the other dietary services that you might need. Let's say if you are not allowed to eat solid foods because you have stroke and we need to provide rehab, you need to be in a skilled nursing facility because you need to be monitored 24 hours. So we can help you gain back your baseline, meaning baseline is that when you're able to chew on your own and when you're able to swallow, and we'll try our best to bring you closer to your baseline. And that will be how quickly and how fast you able to adapt, or your body adapt to recovering to your main original baseline, that you're independently able to swallow or chew your food. That's another thing, or walk or move or transfer. So that's what we provide, and those are all covered by Medicare. Part A, which is the name.
Part A, okay.
Part A.
So so I'll try to explain. So skilled nursing 就是这个专业的护理机构。那刚才Jheni 有讲到，就是那个 Medicare 的 Part A 会 cover 的。那需要有一个 skilled nursing， 就是说你需要有一个诊断，就是需要这个24小时的这个专业的护理，然后医疗监控，甚至是吃药啊。饮食方面专门设计的一个料理，那这种的服务是需要 skilled nursing. So the typical nursing home sometimes do, I mean, it's a different level, right? Different level of nursing facility.
Yes. With the there's a different level of nursing care, but with the skilled nursing facility, we're able to manage the stage we were able to manage wound care, and all level of cares. But if you're on level 1, which means you don't need to stay longer in skilled nursing facility, because there's nothing for you to rehabilitate. That can be actually managed at home. So the only thing that we can most likely will probably accept is level 2 and above. So level 2, when you need assistance in number 1, managing your medication and you're living alone. Number 2, you're not able to transfer or able to care for yourself, and then or you have wounds that that needs to be treated.
So how many levels are there?
Well, actually, it's with there's level of 3, 1, 2, 3. 3 is the most acute, but also they have some other assisted living, which I will actually discuss. That they also have created their own different types of level of care. Sometimes they have up to level 5 because they actually divided that in several different ways. Okay. And Leah can actually interject more about the level of care in terms of the skill, because she has a lot more experience in terms of the skill. I'll talk more on this assisted living because that's my forte.
Okay, got it. So 可以那个笼统的讲，所以 nursing home 是一个统称，然后 skilled nursing 就是要求高一点，就是需要那个专业的护理、专业的这个监控，所以就是 Medicare 会 cover 那个部分。那还有另外就是说 刚才有提到，一般来说有3个 level， 3个层次。那有最基本第一个层次就是你可能需要一些照顾，但是不需要24小时的医护的照顾。那这样的话是不符合 skilled nursing。那可能就是你的状况好一点的时候，你就不再符合这个nursing home 养老院的这个服务了。那可能就会有其他的设施你要去看。那 Jheni 会提到的下面的内容就是包括我们经常听到的 assisted living， 就是辅助性的这个生活设施。Okay, Jheni, we are ready to learn about assisted living.
Before that, I want us to discuss the 2080 rule. So about skilled nursing facilities. So what is the meaning of 100 days when you are in the skilled nursing facility? Because that's a big discussion with the seniors because they don't understand. I thought it was covered by Medicare staying with us. If you only have Part A and you don't have supplementary, meaning you're gonna pay the 20% of your stay in the skilled nursing facility, and that could be very expensive if you don't have Part B or you don't have any secondary insurance. And that's what I want, Maria, because it's go back to because I know that's why I know the skilled nursing facility is a longer discussion also. And then I'll talk about the assisted living and Medicaid assisted living. So Maria, can you explain the 80-20?
Absolutely. So just getting back a little bit of Medicare. So Medicare, I think as mentioned it, everyone that turned at the age of 65 is entitled to Medicare, right? You have to apply for it. The government will not tell you, here it is your card, first of all. Second, just because you have Medicare, in order to use those benefits, you have to be eligible. Meaning you are now 65, you went and get your Medicare card, but you are able to use your Medicare benefits only if you retire and have the 3 consecutive nights at the hospital. In order, you were admitted for 3 consecutive nights at the hospital, and it's a physician who's recommended you to go to subacute or acute rehab. That's when they will send you to the nursing home. So you meet the first 2 criteria, right? You are 65 and retired. Second, you are ill. We're admitted for 3 consecutive nights. That also a doctor is prescribing to go to the nursing home. Once you get to the nursing home, because you have Medicare Part A, you will have 100 days of Medicare. From those 100 days, the first 20 days are fully covered by Medicare. From day 21 to 100, Medicare will only pay 80%. And Medicare, like about 20 years ago, decided that the 20% of co-insurance that the person will be responsible will equal to a specific amount of dollars. So if you do not have a Medigap plan, whether it's a commercial insurance to pay for your copay, or you don't have community Medicaid, or you don't have long-term care Medicaid, then your payment will be you will be invoiced of $194 per day. That's the equivalent of the 20% of Medicaid. That starts adding up on day 21, from day 21 to day 100. Again, that is why we always offer the option to apply for community Medicaid or long-term care or have a Medigap insurance.
Yeah, so probably translated to Mandarin because I want to
yes, that's a lot already, right? Go ahead.
Okay, let me try to do that. I'm totally dizzy now. Okay, 所以刚才在解释这个 Medicare 怎么样 cover 你的 long-term care 的 stay。那按照规定就是 Medicare， 如果你有 Medicare 65岁，然后退休了，可以那个去申请 Medicare 了以后，你去 因为什么原因你去了医院哈，连续在医院里面3天以后，那医院就会看看你的状况，他们觉得你需要去 rehab 去那个康复医院的话，那么 Medicare 可以 cover 100天的这个 rehab， 就是这个康复医院的这个服务。但是里面有一个细节，就是前20天他们是会完全就是付这个你在 rehab 里面的费用。那从20天以后，第21天开始，他会那个要你支付194一天的这个费用。那这个194的这个费用等于就是 Medicare 付这个rehab 康复医院费用的20%。所以就是有这样的规定。那很多人因为这个是很大的费用，比如说你要留80天的话，那你194乘以80就是很多很多的钱。所以很多人呢，就是需要买一些，除非你的收入可以符合 Medicaid 的标准，红白卡的标准，或者是如果你的收入比那个高的话，你就要买一些补足性的这个保险，就是所谓的 Medigap。所以就是还有很多商业的保险，它会就是会 cover 这个部分。I think I did a good job.
Thank you. And now I think that one of the last pieces to know about Medicare is that although you have 100 days and the first 20 are fully paid, and then the second pay on day 21, that doesn't mean you get to use all the 100 days. You have to have a skill need to be in the facility under the Medicare benefits. So saying that if by day 24 the Medicare, you no longer meet the clinical necessity for Medicare to pay, they will tell you, but you might not ready to go home. They may tell you that you need to apply for long-term care. Another of the things to consider is that sometimes under the Medicare guidelines, you may not be eligible to continue staying in the facility under Medicare, but you may qualify for long-term care. Qualifications for long-term care have nothing to do with social issues, and that is sometimes the heartbroken part. Someone that doesn't have no one at home to provide care for them, to help to supply some of the medications, are not considered clinical necessities. Those are social issues, and the ones that we see day to day, they're all elderly, is confronting because the daughters, the sons, the grandchildren, they need to go out to work, they need to go out to school, and they are left alone at home. And that's why there is others places that can also be considered home, like assisted living, independent living, daycares, etc.
Yeah.
So it is possible that although you have your 100 days, you only be skillable. And that's what we mean covered by Medicare only for 7 days out of the 100 days.
OK， 所以刚才 Maria 有提到，就是说虽然Medicare 可以那个cover 100天的这个服务，但一个前提就是医生认为你需要这个层次的这个服务才可以 qualify。那如果有些例子，就比如说第24天，你医生觉得你就可以了，就是可以在别的那个不是在 nursing home 里面，在别的机构 assisted living 也好，回家也好，有一些补足性的那个服务，你就可以康复了。那这种情况下，医院就是不能再，就是这个疗养院就不会再给你提供服务。那很多时候就是有些时候有一些是社会的问题哈，比如说一个朋友，就是他的身体就说不好，就是已经治疗了，可以回家了，但是家里没有人可以照顾他，或家里人有很忙的工作，不可能24小时陪着。像这种现实的这些状况，医疗保险是不考虑的。所以就是这时候家人就是要考虑这些 assisted living， 就是辅助性的生活设施，这些其他的这个选项。 Okay, it's 5 o'clock. Let's talk a little bit about assisted living, and then we can just wrap it up for today and answer some
Okay.
questions. Okay.
Yes. So there are different types of assisted living. Assisted living, they have they have several requirements also. Assisted
Can we
living.
go to the slide? Sorry,
Oh, I mean, Maria.
Maria. Yes.
One more.
Okay.
Oops, go back. Oops, right there. Yes.
Perfect.
Perfect. So assisted living. So there are different types of assisted living. So assisted living, they're all focused on providing the ADLs, meaning ADLs that if the senior need dressing, bathing, eating, transferring, medication management, those will fall under assisted living. And there are different types of assisted living. One that has a specialty with memory care. Memory care meaning if you needed focus care when your loved ones or a senior is experiencing issues in cognitive issues, that he can be confused, he cannot be has elopement issue, or he needs more place that have safety, and making sure that he is not able to leave outside without monitoring. That's what we call memory care assisted living. So there is also group homes. It's also called assisted living. Group homes is the one of the most inexpensive type of assisted living, because normally in Montgomery County, most of the time they only allow 5 residents in a group homes. It's actually it's a mix of the demographics. When I say demographics, it's a mix of different types of patients or senior resident. The senior resident can be just need assistance for the daily activities, or you can have a senior that's living with you also that has memory issue or has dementia. Or in the group homes also, you might also have someone that that is also have intellectual developmental disabilities, but he's a senior also. So that is a group home. So those are different type of a group home for a senior.
I think we did a good job on the slide with translation. So basically,
okay.
Yeah, 所以刚
okay.
才大家看到 assisted living 就是可以提供就是生活上的这种照顾哈，包括穿衣、洗澡、吃饭，那个使用浴室，然后这种有不同的方式。大家知道有一些退休的社区哈，大家看到 Montgomery County 周围哈，就是都会有留意到有不同的这种assisted living 的这种社区，然后也有可能有时候就是很小的一个 group home， 就是一个房子里面就住的最多的5个人，那他们也是这个设施里面就是住在这个设施里面有这样的服务，对，所以刚才这里说这个 assisted living 通常是要自付费用哈，或家庭来付费。OK，Medicaid 大概会付20%。
So assisted living, so they have, and when you're looking for assisted living, it's important to identify your budget. And then if you don't have enough budget, then you can actually choose either group homes or the locations. Location is also important for that, you know. So it causes
group home is less than the community, retirement community.
Yes, it's actually for the group homes. You can also see around 4,000 to 5,000 for a private room for a group homes.
Ooh, okay.
Yes, that's a good, especially if your family has dementia. For for a senior with dementia, it's easy to go up to 7,000 to 10,000 or even 15,000, depending what type of facility or assisted living you're looking for.
所以刚才 Jheni 有讲到，就是assisted living 就是看它的那个位置哈，地理位置也是很重要的一个对那个价钱一个很大的区别。然后里面提供的服务啊，或者很多时候就是装修情况啊，也是会影响到这个费用的这个那个层次。然后另外一个就是Jheni 有提到 group home， 就是刚才讲的一栋房子里面几个人住的这种养老的这种房子，那这个费用通常是最低的，大概是4000到5000块钱。那然后还是不同的服务的层次，那收费是不一样。
All right, so with the other one, which is Medicaid assisted living, so for anyone that will looking for or needed for a Medicaid assisted living, the process is the fastest one is 2 years, up to 5 years, sometimes up to 10 years.
Okay.
So it's a longer wait for that. So it's the fastest way for you to get into a Medicaid assisted living is when you actually get admitted to the skilled nursing facility. Yeah, nursing home.
And then apply for community waiver.
Community waiver, because the social worker can actually quickly, you will be on the priority list, because what the government or what they look is the urgency and the need. So is where it's actually depends on where is the setting. So if you're in the setting at your house, meaning you're still secure and you're still safe, you're in your home. So you still, they will actually try to see if you can still able to live there or get some support in home care or home health.
Okay.
But that will take a long time for you. So,
Okay.
But in the in the skilled nursing facility, that is gonna be up to 90 days, the longest. Sometimes up to 60 days is the quickest.
Yes, so 刚才讲到就是 Medicaid 有可能支付 assisted living， 我们的这个翻译不对哈，不要管它。那个 Medicaid 是有可能 cover assisted living 的这个费用，但是你在外面申请可能就是5年10年都说不定。就是要申请这个 assisted living 的这个项目，但是有一个就所谓的那个快捷的通道，就是如果你从 nursing home 里面，刚才讲到在 nursing home 里面申请到 Medicaid 的 long-term care， 这样你就可以申请到 long-term care 这个资格以后，可以用这个 long-term care 的资格去申请住在外面的这些 assisted living 里面。那这样就是你的费用 Medicaid 会付。这种情况在所有的 assisted living 的这个行业里面，大概就是占12%的份额。
So with assisted living, one thing that they're asking how much is assisted living. Assisted living cost varies if you go to assisted living. That's why I always recommend, if your budget is really very constrained, is a group homes, because it's all level of care, as most of the time are inclusive. For the assisted living, the most inexpensive that I've seen, because I place a lot of senior and help them look for their assisted living place, is 6,500 just for the rent, and that will actually varies by the level of care, level 1, level 2, level 3. But sometimes other assisted living can extend into it up to level 5. What they do is that they actually count the ADLs. So if you have needing, let's say if you're level 2, because you only need assisting in dressing, and bathing. So that's they can, you know, they will include that in level 2. But in level 3, if you need to go to eating and then going to the bathroom, then that will increase again. Some other cases is just straightforward level 1, level 2, level 3. So the most expensive is level 3. So some of the assisted living, the level 3 maximum additional 3,500 because they charge you from $750 to $1,000 for level 1. Level 2 could be as expensive as, you know, $1,500 to $2,000. So and then the most expensive I seen for the level 3 or full all inclusive is 3,500. So you add that into 6,500 plus 3,500, that's quite expensive. That's only assisted living. I'm not talking about memory care, which is total care too.
So $65 is basic.
Yes, basic.
Okay.
Which is they will probably add some of them everything is inclusive for basic that's include the medication management. Some of them they will charge you medication management on top of the 6,500 per month, which is sometimes they charge 350 per month or 250 per month, or some of the other places that are very expensive, they charge you $50 per day, which is very expensive.
So someone asked 6,500 is actually monthly.
It is monthly. It's no. I will move in if it's yearly.
We are living in this United States. OK， 所以6500块钱是基本每个月的基本费用哈，就是没有什么特别的服务的话，就是基本是6500块钱。那如果你刚才讲到有1层次、2层次、3层次的服务，就是往上越往上，就是每一个层次都有额外的费用，就看你需要的那个服务是什么样。对。
Yes.
Okay.
That's why I always encourage, you know, I'm nothing against about assisted living because they provide a lot of activities and programs compared to the group homes. Group homes is very limited with the program because you're only in the small residential home. Yeah, you have a little bit, you know, backyard and other activities that they come. But in assisted living, you have a lot to explore what they have. Some of them, they have a pool. Some of them, they have physical therapy. That's what's the cost.
I saw that, and so I envy them. Anyway, so 对，所以就是费用有很大的不一样，也是看你那个设施的那个设置，还有就是服务都不一样。那通常group home是最便宜的，但是也没有什么特别多的这个娱乐啊，或者是其他的服务。所以是这样一种状况。Okay, I think we got a great idea. I mean, I regret that I only have this time, and I would love to hear the rest. I know you prepare a lot of contents that we would all very love to learn more about. But let's schedule another time and have a part 2.
Yes.
Okay.
And then prepare your question ahead of time so we can discuss that, you know, and email you guys.
Yeah, so you can just run through quickly what other topic you can cover. So I see that we will talk about hospice, 就是
home health. We're going to talk about home
health and potential 潜在的这些人口趋势，然后 supportive housing 是怎么回事，然后。
And then also we discuss about other chronic shelters. We have a lot of chronic shelters. They're a really nice place. So don't be afraid about the shelters. They're really a good place to go if you really don't have any place to you know, if you are not 65 and you're not qualified to other group homes or skilled nursing facility, there's a lot of shelters there. That's really nice.
And thank you so much, Maria. Already answered the question what that is put in English, so Maria can conveniently answer the question. And Okay, so I think Jenny and Maria, please put your contact information in the chat box so that our participant can reach out to you if they, I mean, I'm sure they have a lot of questions. I'm actually a social worker. When I'm hearing this, it's all very new to me too, and we need time to digest and learn. But don't worry, everybody. Just like any other things, we hear it again and again and again, and when the time comes that you need to learn more, you will have the opportunity to get to know more. 所以刚才就是跟大家讲一下，我知道听起来就是很多信息，需要很多时间去消化，不太容易都了解全局。然后刚才有讲到，就是这个讲座其实有很多其他的内容，我们没有时间去今天全部讲完，但是我们肯定会再安排一次第2集，会讲到后面的，比如说临终的服务啊，临终的医疗服务啊。或者是有一些就是照顾疾病的这种临时的这种 shelter， 就是照护的地方有这样的服务，或者是有一些居家的服务，医疗方面的居家服务也是有很多选项的。那我们会再另外安排时间来跟大家来做另外一个讲座。好，那今天的内容我们就先到这里。提醒一下大家哈，如果你还没有sign up subscribe 我们的那个 newsletter， 就是那个电子邮件，每个周3会向社区发布的这个电子邮件的话，请千万就是subscribe 一下，我们的同事会把那个 link 放在 chat box 里面。如果你每周3都收邮件的话，证明你已经是在我们的那个名单上面，所以就不需要。如果你没有收到的话，请大家登记一下，这样你们不会错过像今天这样好的讲座，不会错过。Okay, so thank you so much, Jenny and Maria. This is so informational and packed of information, and we need to learn more. And I'm sure we need you to come back and talk to us more about aging and how are we going to deal with all this complicated issue.
Yes. One thing that before we close, it's a very important thing with the qualification. Right now, the Medicare waiver is still approved, meaning normally the requirement is hospitalization. You don't need 3 days right now because of COVID. The CMS or the Medicare allows you to go directly to the skilled nursing facility. For example, if you decided to go home and then you are your parents is hospitalized in the hospital and they are requiring you to go to the skilled nursing facility and you decided to go home, you can still go to skilled nursing facility provided that you are Medicare benefits. If you don't have a Medicare benefits, it's a little bit work. We will have to ask for the insurance to get you approval to go to a skilled nursing facility. The other one also is because the waiver is still up. Your physicians that actually can make a recommendation, whether a physician or a nurse practitioner, when they evaluate you or did an assessment, physical assessment, and they feel that you need to go to a skilled nursing and rehab. For example, you have a UTI or you have a wound that needed attention, and you need some other rehab because of that. Then they will actually can write a prescription or they can write a note, and you can submit that to any of the other skilled nursing facility, and they will accept you and review the clinicals and will process that. It could be the same day, it could be the next 2 to 3 days, depending how you complete all of your paperwork.
所以刚才 Jheni 有提到，就是 COVID 期间，如果你在医院里面被 discharge 的时候，你还有一些需要那个医疗上的照顾，但是医院准备 discharge 你回家的话，你可以跟医院商量一下，把你 discharge 到 skilled nursing， 看看你符不符合这个资格。如果你是有 Medicare 的话，刚才我们有讲到 Medicare 会支付 skilled nursing facility 的费用。然后另外一个就是社区的医生，他们为你做了全面的体格检查以后，认为你是符合 skilled nursing facility 的话，医生也可以写这个证明，然后你可以申请到 skilled nursing 这个facility 这种机构里面去得到那个医疗照顾。所以这方面具体的内容，如果大家有更多的问题的话，在我们的 chat box 里面有 Jheni 和Maria 的 contact information， 就是这个信息，大家可以去去联系他们。So one last question, can I put the slides on our website so that people can get to that?
Yes, of course, yes.
OK， 所以刚才有朋友问到能不能有这个 slides， 那我会把这个 slides 变成 PDF， 然后放到 ccacchealth.org 我们的网页上面，大家可以上去直接下载。我们下周3会出这个新闻，就是这个电子新闻，我们也会把今天的录影在上面分享，所以大家一定要 sign up to 我们的这个电子信息。好，今天非常感谢 ，Thank you so much, Jheni and Maria. Very informative, and I'm sure I will have you back very soon.
All right. So yeah, just contact us if you are, don't hesitate. Send us an email whether you feel that you need to go to a skilled nursing facility or assisted living. You can actually contact both of us, either Maria or me. Any question, please don't be shy. Don't hesitate. Call us because we would love to help you rather than you get the wrong information. So we can help you and direct you to the right place.